Hi, I'm Dr. Wilshire at Missouri Fertility. I'd like to discuss with you the concept of embryo banking. If a person or a couple has decided that they want to do in vitro fertilization to grow their family, sometimes we run into trouble in that we're not making as many embryos as we would like. Human reproduction is very inefficient, and unfortunately, we don't always get as many children from as many embryos as we create in the lab. Not every embryo is healthy. Not every embryo has normal genetics. And unfortunately, as a woman gets older, we generally get fewer and fewer viable embryos for transfer. Transfers are where women hopefully get pregnant, and that's the final step of the advanced reproductive technology process. The in vitro fertilization part of the process involves retrieving eggs from a woman, fertilizing them with sperm, and then generally having the embryos grow for about 5 days. Many of our patients then go on to have what's called an embryo biopsy and pre-implantation genetic testing so that we can have a much better idea if the embryos that we have created in fact have normal chromosomes and the capacity to create a healthy baby. Sometimes as a woman's getting older, frequently in her late 30s or early 40s, we may get a good number of eggs, but sometimes we'll get a disappointing number of viable embryos after the process. For this reason, women frequently elect to do another in vitro fertilization cycle to accumulate or bank additional embryos. This is important. As a woman gets older, she has fewer and fewer viable eggs. And let's say a woman does IVF at age 38. We're able to create 1 or 2 viable embryos. We do an embryo transfer. God willing, she gets pregnant, has a healthy baby. Realize that if she wants to have another child, she may now be in her 40s. She may have run out of eggs. We may have very poor performance if we wish to do in vitro fertilization 1, 2, 3, 4 years later after the first retrieval. For these reasons, frequently people want to do a couple IVF cycles where we create embryos, and sometimes by doing 2 or 3 cycles, we can accumulate enough embryos and get them what we call in the bank so that we can be done with the in vitro fertilization and hopefully have enough embryos over the coming years to do enough transfers that a family or a woman has the children that they want. So that's an important concept to understand. Make embryos while you're as young as you can be and do transfers later in the coming years. As long as you're healthy, that can be an option. So I hope that explains embryo banking and why sometimes you want to do 2 or 3 IVF cycles before moving on to embryo transfer. It's Dr. Wilshire at Missouri Fertility. I look forward to working with you.